Right. Good morning, and thank you for joining us, everyone. I'm Amanda Marti from Delta Orthopedics, and today I am joined by physician assistant Jose Marti to talk about common injuries and treatments in the face of a car accident. As always, please leave any questions or comments in the chat section, and we'll be sure to answer them during this segment. Before we get started, I did want to read the disclaimer. Jose Marti is a physician assistant with the supervising physician at Delta Orthopedics. The content and questions asked in this segment are based on Jose's own experience as an orthopedic PA and are for educational purposes. For specific information related to your unique situation, please call to schedule an appointment with a medical provider. The content provided is not to be assumed as treatment for any listener or viewer. So with that said, welcome
Thank you, Amanda,
for being with us. How are you?
Doing good. How are you?
Good. Awesome. So let's jump right into it. The first question I have is, what are the most common body parts affected after a car accident?
So this will vary slightly by provider, but the most common are for sure going to be the neck and the lower back. Follow from that is going to be shoulder, and then following from that is probably going to be some ankle and foot injury, maybe the knee injury. It really depends and varies on the mechanism of injury when it comes to the accident. Did you get hit from the side? Did you get hit from the rear,
Right.
from the front, T-bone, side swipe? It really varies a lot, but I would say that more often than not, the neck will have some kind of a whiplash. And in doing so, the neck is just simply the most vulnerable. And then the lower back, believe it or not, there is such a thing as whiplash from the lower back. It's just not as impressive or extensive as something that you would see from the neck. The other thing that happens is more often than not, we're holding onto the steering wheel, right? So it's very common to see a neck and shoulder combo when it comes to the injury. And it's something that is often mistreated because a lot of providers may think that the neck is just simply what we refer to as radiculopathy, meaning pain extending down from the neck into the arm, or numbness or tingling. But sometimes they miss that part in which the shoulder can be hurt as well. And then we're now concentrating on the neck when we should be concentrating on both and try to treat both of them at the same time. But yeah, to answer the question, I would say definitely neck and back for sure. And then follow that, it would be a combination of injuries such as neck and shoulder, or lower back and knee, or lower back and hip, something to that extent. Okay.
Got it. Okay. What's the most common treatment after a car accident?
Oh, that's a good one. So after a car accident, I would say that the typical, when it comes to personal injury, the typical almost go-to is going to be chiropractic care. All right. And we don't provide chiropractic care here at Delta Orthopedics. However, we work very closely with a lot of chiropractors in the community. We're great friends, and they do great work. What you typically see is the patient finds an attorney. From the attorney, gets sent to the chiropractic care first. From that, then based on maybe a few treatments or however the chiropractic feels the medical care is going, then it gets sent over to the orthopedic side. With that said, there is no true right way or wrong way of going about it. Sometimes the patient may come to the orthopedics clinic before they even have an attorney or they even have a chiropractor, and that's fine too. We can help them find an attorney as well as find a chiropractor based on what the necessity may be. The necessity may be chiropractic care. The necessity may be physical therapy. Some chiropractors provide strictly spine care, that's neck and back, and they may not really focus so much on the extremities like shoulders, elbows, and wrists and stuff like that. In which case, it may not be a bad idea to provide a little bit of physical therapy in conjunction to that care. With that said, there are some chiropractors, great chiropractors, that do provide care for both spine and extremities. And by all means, that is also a great source. More often than not, however, it is a great combination to add the orthopedic side, more medical side is what we refer to it, and the chiropractic care in conjunction, because it's almost like we treat the pain and the injury differently, but we're still treating the pain. And in doing so, we can hopefully get the results that we want faster, which is what every patient and every provider and every attorney wants in any particular situation when it comes to a motor vehicle accident, slip and fall, or even workers' comp. With that said, you need to, everybody is just simply different, and we just kind of need to just give that body the time it needs to be, and the proper treatment needs to be to get better at its own time.
Mm-hmm. So the way that I understood that question, or that I read that question, is for common treatment. So like, what is it that you see in your office the most that seems to help the most patients? So as far as like actual treatment, so what is it that you do a lot?
Right. So that is a loaded question. I love that question, but it's really differs between injury and body part, neck versus shoulder.
Right.
Is there a tear of the rotator cuff versus there's a herniation in the neck? I would say that that's a great question. I love that you took the time to kind of like bring us back home a little bit. So I would say that even though that there is a variety of injuries and they'll differ per body part, the knee versus the shoulder versus the wrist versus the neck versus the back, the injury will vary. With that said, more often than not, I would say 90 to 98% of the time, there is an underlying cause, which is inflammation. We often will go after the pain, or we'll go after the tear, or we'll go after the fracture, or we'll go after the herniation. And I'm not discarding that we shouldn't in any kind of way. It really depends the severity of each of those things, the severity of the fracture, the severity of the tear, the severity of the herniation. It really depends on it. But more often than not, the inflammation is really what's causing the pain. And if we as providers start going after the pain and not after the inflammation, a lot of times we can actually create an issue. We can create a dependency issue, because we can treat this pain as much as we want, but if we don't treat the inflammation, the pain is really never going to go away. And now we're down the line 2, 3, 4, 5, 6 months or longer, and we haven't done anything. So in order to treat the inflammation, there's different ways that we can go about that. A lot of them may involve physiotherapy, physical therapy. From our end, we try to treat it with a little medication. It could involve some oral anti-inflammatory medication, and you guys heard of them, over-the-counter ibuprofen, Motrin, Advil, all of those. Prescription, then we move into the naproxen, ibuprofen 100, Mobic, all those medications. But more often than not, we like to add a little bit of steroids that are simply synthesized for the sole purpose of calming down inflammation. And in doing so, they just kind of help bring back the fire just enough to make way for our more conservative treatment, like physical therapy or chiropractic care, to be able to be actually viable and doable, effective, right? Because sometimes people are in so much pain because of the inflammation that they're not going to let the chiropractor touch them.
Exactly.
It's just, it is what it is, and we are human beings. We understand that, you know what I mean? Furthermore, we like to use some more regenerative and more natural processes or properties that we get from the body itself. So I'm referring to plasma or platelet-rich plasma. This is something that we can acquire from the body itself and actually
Mhm.
put it exactly where the injury is.
Yeah.
Very often used for tears in the knees or in the shoulders and stuff like that.
Mhm.
And we can use the same properties that help the body heal and mesh different tissues to do so in a very natural type way, as well as calm down the inflammation, right? We always come back to that.
Mhm. Awesome. Okay. So after a car accident, when should I get medical attention?
Immediately. Really, it's hard for a patient one way or the other to really know the severity of the accident right away. You know what I mean?
Right. Right.
And adrenaline, that's a real thing.
Yeah.
It's a real thing.
Mhm.
And this fight and flight, this feeling of I'm okay, I'm shooken up, I'm okay,
Right.
and I don't know whether I have pain or not or whatnot. But more often than not, we'll find out by the next day, what the issues are, right?
Mhm.
So it's really best for many reasons, for the medical reasons and the well-being of the patient. The sooner the better, because you really just don't know. Even as a medical provider, I were to
Mhm.
get into a car accident tomorrow, I really don't know how bad the accident was
Yeah.
until I'm fully evaluated, with the proper imaging, with the proper examination, with the proper diagnostic studies, and treat it accordingly. The sooner you treat a patient, the better.
Mhm.
The other thing I wanted to mention, legally, the sooner something can be documented by the right provider,
Yeah.
the right medical provider,
Mhm.
the better, because
Right.
now obviously you've obtained and hopefully you've obtained a police report from the accident, so
Mhm.
you have that documentation that the accident happened and yes, you're not at fault. And then the second thing is now you've acknowledged and have someone acknowledge, a medical provider acknowledge, in a medical documentation, legal documentation at that there is truly an issue,
Mhm.
and understand that this issue, because it's so close to the accident, may
Mhm.
actually get worse before it gets better.
Mhm.
There might be even more body parts that arise, that are hurt, that you didn't know, that you didn't realize that day. You know what I mean?
Right.
So the
Yeah.
sooner the better, hands down.
Mhm. Yeah. Yeah, for sure. I remember when I was in a car accident on the um the 75-85 connector.
Hmm.
And I mean, thank God we all ended up being relatively okay,
Right.
but our 1 month old was in the back seat and I got
That's right.
rear-ended and like going 70 miles an hour. So much so that I hit the car in front of me. So I got hit in the back, and then I hit someone in the front. And I remember getting out of the car immediately and checking on Sophia. Of course, she was
Hmm.
totally fine. Whimpered for a second and then was fine.
Hmm.
They say God protects babies and drunks in car
Amen.
accidents. So,
Amen. Yes.
but yeah, I remember feeling pretty fine. Like,
Hmm.
I was able to drive the car home, thankfully. And I just remember going home. But you at the time were, working as an orthopedic PA, so going to be able to see you right away, and then seeing one of your colleagues.
Hmm.
I definitely remember that being really helpful
Right.
because
Hmm.
at the time I didn't feel really much, but like within a week, my lower back really started to bother me.
Hmm.
And, had I not known maybe that information or had gone to see someone right away, I maybe just would have like wrote it up. It wasn't enough to cause me like
Hmm.
waking up in pain or, causing like severe discomfort. It was just kind of like, oh, I'm a little achy,
Right.
it'll probably go away. I'll probably be fine. But I ended up getting an epidural in my lower
Mhm.
back, which was really helpful. And
Right, which is something that we do provide here at Delta Orthopedics for sure.
yeah, so yeah, it was an in-office
Mhm.
procedure, which I was really surprised to find out about just how like quick and simple it was.
Right.
Because you hear epidural, and I know a lot of women, of course, think
Freaks you out a little bit, you know?
Yeah, it freaks you out. And
Yeah.
I know for me as a woman, I always associated epidurals with childbirth. Like you get an epidural when you're going to, it's nowhere near that same kind of like intensity, when they call it an epidural and stuff. So, it is in the same space in the back, but it's certainly not to that kind of like, you're not going to be dead from the waist down or anything that. So it's very, very localized, and it really definitely helped with moving forward. So yeah.
That's great, Amanda. And something that I wanted to share, that two points that you actually mentioned that a lot of people may not realize. The first one is when you were in that car accident, you were obviously impacted from the rear, and then you hit the car in front of you. That's what we refer to as a double impact motor vehicle accident. It's very important that we understand and note those factors, because that adds to everything, right? So not only did you got hit by the car behind you, but hit the car in front of you. So this is a we always refer to it as a medical and legal aspect of it. So this will obviously affect your legal side, but in the medical side, which is the one that I can speak to, is almost like you're having a double whiplash in the opposite direction,
right?
The neck and the back, right? Does that make sense?
Absolutely.
You know what I mean?
Yeah.
And then when that happens, obviously the possibility of injury to the neck, back, and shoulder, or any other body part is increases significantly. The other thing that you mentioned is being able to kind of get that care right away. Is it made me think. I actually have a patient right now that I'm seeing under medical insurance. Is not so much personal injury, but he unfortunately was in a car accident. It wasn't his fault. But he waited over 5 months to be treated. Ideally, we get treated right away. We see an attorney right away, because now it makes it very hard for the and after having a conversation with the attorneys, makes it very hard for the attorneys to really prove, is this pain that you're having really coming from the accident that happened 5 months ago?
Yeah.
The actual answer is very likely, but can it be proved?
Right.
And that's something that we just kind of need to understand, that if you are in a car accident and you're seeking the proper care right away, legal and medical, it's okay. It is okay. Yeah. You are not crazy by doing that. You are not being too much.
Right.
You are not being overly dramatic, or you're okay. Why are you doing this? No, you're doing the right thing that needs to be done at that point in time.
Yeah.
So absolutely. All right. I don't want to stay too long on the same question. I'm sorry if I.
No, you're good. Are you also seeing another patient who was in an accident, and then you treated him, even might have released him, and now he's back because the pain is back?
Right. Yeah.
So that's also another thing that people might get, worried about, is like, oh, I'm afraid to stop treatment because, what if it comes back? You can always come back and be treated again.
As long as the case is not closed.
Right. As long as the case is not closed.
You can always come back under the case. Once the case is closed, that's a little bit trickier.
Right. It's a little bit hard.
Legal question.
But you can, if you have, if you do have personal insurance, obviously that's still always an option.
Right.
And then you're seeing a provider that already is aware of, what you've been through before. So.
Absolutely.
Great. Our next question is, should I go to the ER or urgent care after a car accident?
That's also a great question. And that's a toughie. The answer to that is, do get checked as soon as possible. Obviously, if the ambulance shows up and you are non-responsive or whatever, you kind of don't have a choice. They're going to take you to the ER, and that's really up to, once the ambulance gets there, the paramedic or the EMT is going to do a full evaluation, and they'll give you a good assessment. They're very well trained. They'll give you a good assessment and a good their opinion. Hey, you should probably go to the ER. At which point it's good to understand and know, hey, I should probably go to the ER.
Yeah.
And or they, hey, not too bad. They'll send you to the urgent care. Either way is really up to between you, what you want to pursue, and also using some. I mean, the paramedic. They're professionals at what they do. Yeah. So understanding that they are first responders and all of that is, their word should weigh heavy. Now, this is what happens, and I cannot tell you legally to not go to the ER or urgent care or whatever. So I can't move you in one direction legally. What I can tell you is this: a lot of times, especially if it's a soft tissue related problem, which is really, how do you know this as a patient one way or the other? It's really hard to know. But it's something, those problems, even some fractures, and definitely, I would say most issues that arise from a car accident can be dealt with even better by your orthopedic clinic that does personal injury than the actual ER. And reasons are pretty simple. The orthopedic clinic as a specialty, that is all they do day in and day out.
Right.
I don't deal with hearts. I don't deal with lungs. I don't deal with vasculature. I mean, I have to assess all that and whatnot in my physical exam. Yeah. But I don't deal with all of this other stuff that makes me not be a specialty.
Right. Yeah.
And in doing that, it just, by common sense, it just simply, more often than not, makes you it gives you a little bit more understanding with those types of injuries, and how to treat them, not only in an acute manner, but in a chronic manner, just simply because it's what we do, it's what you do, Inversely, if I went to the ER, or if somebody showed up to the clinic and showed me an EKG, I could probably weather it, but I wouldn't be able to read it like anyone from the ER could, or your
as intensively.
You know what I mean?
Absolutely.
So that is something that needs to be considered in this part, and it's ideal it's considered. But you know what, Amanda, there's so much happening when you get into a car accident, between your own medical necessities, the car, and the car being an issue. If there were other passengers in the car, in your particular case, one of the kids was in the car. There's so much going through your mind that is hard to say that whatever it is that you do or don't do is the wrong thing. What I would suggest is that you just simply do something,
Yeah, right.
Be checked out medically as soon as possible, and get in touch with an attorney as soon as possible.
Yeah.
And most attorneys, if not all, they do a free initial consult. So it's not like you're spending any money.
Right.
You tell them, hey, this happened.
Yeah.
What do you think I should do? Oh, we should do this and this and this. Okay. And most of them, when it comes to personal injury, and this is, again, something that if you were to come to see us at Delta Orthopedics as a patient, we could not only see you initially as a patient, but also we could set you up with an attorney, someone in our network that could help you out. But what I say all this to say that most, if not all, attorneys will not charge you anything until the case is over, until the case is won, right?
Yeah.
And the majority, if let's say the case for some reason falls through, because it does happen, they won't charge you anything. You know what I mean?
Yeah.
So so it's things that we do or don't do because we fear not doing them,
right?
Only to regret it later on.
Yeah. I also know that, we've had some patients come in under their own personal insurance. And then we come to find out that, hey, actually, they were just in an accident a week ago and
Right.
they didn't think about contacting an attorney because it wasn't that big of a deal or whatever in their mind. That's certainly not too late. I mean, obviously, the sooner the better.
Mhm.
But, if you are in a car accident and if you have, paid like your copays or anything like that, that almost always gets taken care of by the case if you do see an attorney.
Right.
So
Yeah.
something that we have
Yeah.
experienced at Delta.
And it absolutely happens. We're blessed enough here at Delta Orthopedics that we have great relationship with the attorneys that we work with, and we work with many attorneys across the state of Georgia, and in doing so, it's just a quick phone call to either one of them.
Mhm.
Hey, I have this patient that this and this happened, and do you feel like it's something that you would be able to take on?
Right.
Yes
Absolutely.
or no.
Yeah.
You
For sure.
know, and if it works out, great. If it doesn't, but we definitely have that with medical insurance. We also have that with workers' comp.
Mhm.
Sometimes some people get injured at work. They don't realize that they were even injured at work, and then only to find out, we sit down with the attorney. It's like, no, absolutely, you have a case, and they can definitely help you from a workers' comp accident. So then we can see you medically, and then we can find an attorney that can counsel you through the legality of personal injury or workers' comp.
Absolutely.
But don't cheat yourself as a patient. I'm not, now I'm
Yeah.
talking to whoever else, the audience, I guess. Don't cheat yourself as a patient when something like this happened, because you either don't feel that much discomfort right away, or and you feel like you don't have time, right? Because then if this becomes a chronic issue, the investment is going to be a lot more than if you were to kind of like nip it in the bud right away.
Yeah, for sure. Awesome. Okay, so it looks like we have a question. Years ago, I had a car accident and didn't receive treatment. Now I feel pain in my neck and numbness in my legs. Should I go to the orthopedist or to the chiropractor?
All right. This kind of brings us back to the disclaimer a little bit. So
I guess if this was you,
what
would you
me, right?
do?
The disclaimer. So just so X-Men Producciones, I love that. So if this were me, okay, and I've dealt with both, right? The first thing that I would do is see an orthopedic doctor, right, or provider, for that matter, and understand what is causing the numbness in the arms or in the legs. And it might be just a simple MRI, or X-rays. For the most part, the medical side in the orthopedic realm has it's a little bit easier for them to order some of these modalities, particularly when we're talking to medical insurances and whatnot. And then what will happen then is, once you understand exactly what's happening, and you have a good grasp and understanding of the anatomy and the physiology that is being affected, then you can make the decision into picking a chiropractor or picking a physical therapist or picking both based on the issue, right? But is in my opinion, is good understanding the full extent of the anatomy and physiology of what's going on before you pick someone like a chiropractor or even a physical therapist. Because what may happen, let's say you have a large herniated disc in your neck. The chiropractor doesn't realize that for some reason. He goes to adjust you. And again, I'm not saying anything bad about chiropractors. I absolutely love them with my dear heart, but he goes to adjust you, and all of a sudden the numbness and tingling gets worse. Or for your lower back, and adjust you, and the numbness and tingling gets worse, right? So, but let's say you do proper evaluation prior to, with the proper MRIs, proper exam, and understand that, hey, this numbness and tingling are simply coming from inflammation in the facet joints that is irritating some of the tendons that are near the facet joints in the neck or in the lower back, and then irritating some of the nerves that are causing discomfort coming down the legs. At that point, soft tissue care and chiropractic management with physiotherapy, that's great. That's awesome. You understand the anatomy, you understand what's affecting it, you understand the physiology behind it, and boom, you know exactly what to do and how to do it. And all of a sudden, you can pair them up. You can do a little bit of medications with the orthopedist along with the chiropractor. You can do a few steroid injections, which is something that we have to talk about, steroid injections, at some point in time. I think we might talk about it later on, but absolutely, I would suggest in this particular situation, I'm not saying in every situation, in this particular situation, from an educational standpoint, not as treatment, I would suggest that you first see the orthopedist, and from then on, once you fully understand what's going on, then you move on to picking your adjunct care, is what we call it: chiropractic, physical therapy, massage therapy, physiotherapy, those kind of things is what we call adjunct care under this particular circumstance.
Yeah.
Cool.
And which we also refer out to as well.
Right.
So we have chiropractors and physical therapists also in our network that we refer out to on a regular basis. So we can take care of you from that end as well. Okay. Do I need injections for my injuries after my car accident?
Oh, wow. So the answer is no. Never do we actually need injections, right? We go back to that underlying issue of inflammation that happens in almost 90 to 98, 99% of patients with any motor vehicle accident. The inflammation slowly just kind of grows over time. And what happens is this: it's very simple. We start as conservative as we can, maybe with a little bit of proximal flexor. That's the proximal flexor as a staple for almost any ortho, and even in the ER. Staple medications. And naproxen anti-inflammatory medication helps come down the inflammation, and Flexeril is a muscle relaxant, helps relax the muscle. And as a byproduct, it actually, one of the side effects of a muscle, or most muscle relaxants, not all, but most muscle relaxants, is that it makes you a little sleepy. So in doing that, obviously you don't want to take it throughout the day, but it helps you sleep at night sometimes. It gives you that little melatonin easiness to go to sleep. So those are the staples, right? But what happens is then we add maybe chiropractic care, maybe we add a little physical therapy. So now we're very non-invasive, very conservative, right, in everything that we're doing. But all of a sudden we notice that these things are even though they're helping, they're not lasting. A lot of the comments that I get is while I'm there with the chiropractor, everything is so great. But then a day or two after, it's just all the pain goes back. And I want this to go for the record, this does not mean that the chiropractor is not good or the physical therapist is not good at what they do. What's happening is that the inflammation is getting better while you're doing the adjustments or the physiotherapy or the exercises, whatever it may be. And then we're allowing your body for the inflammation to grow again. And this is inflammation that is now uncontrollable by the body. Most inflammation is very controllable by the body on a normal state, not in the face of injury like car accident, fall, or anything like that. But this is now inflammation, and what I like to do is use the analogy of fire. This is a fire that all this conservative treatment is just not really making it better. So when injections come in, typically is to bring in some kind of anti-inflammatory medication. More often than not is used by a little bit of steroids. These steroids, again, are simply synthesized to calm down inflammation. They're not going to make you all bulky and big and whatnot. Simply just to calm down inflammation, right? And what happens is almost what I tell my patients is your body will talk to us, meaning if chiropractic care is doing what it needs to be doing and your body's responding well to it, it'll simply get better, and it will not lead to even having the conversation of doing any type of injection, right? Because you're better. Why would we even have the conversation, right? But if the opposite happens and we're having this conversation of, man, when I meet with the chiro, I meet through physical therapy, I feel so great, but by the next day, boom, I'm
Yeah.
struggling again.
Yeah.
And then we're having this conversation 1 week, second visit, third visit, fourth visit.
Mhm.
I need to sit down with you and be like, hey, I know I don't want injections for myself. I don't want injections for any of my patients, but your body is putting us in the situation. What do you prefer that we do? You know, in my opinion, in this particular case, it would go very well if we do a conjunction of a little bit of steroid treatment or therapy,
Mhm, mhm.
um, along with your conservative treatment, and let's see
Yeah.
what happens.
Yeah.
If it works, great. If it doesn't, we'll figure out another option.
Now,
Okay.
for those that have taken steroids orally
Mhm.
versus an injected steroid, can you tell me real quickly kind of like the difference with that?
That's it. That's a great question, and I thank you. Thank you so much for asking that. So oral steroids are more often than not doesn't have to be like this, but more often than not are taken in what we call a pack. Okay, so
Mhm.
this is a 6-day regimen of a tapering dosage of steroids. So you
Mhm.
probably start with like uh, 5 or 6 tablets of steroids, and it tapers down until, let's say you begin on Monday, you end it on Saturday, and it tapers down until there is none. The injectable steroids is typically going to be between 1 to 2 cc's, which is a very small amount. I don't even know how to refer
Like
to that in layman's
this
terms.
much.
It's this much, right? Yeah, right. It's a very small amount. Okay. The difference is with the oral steroids, you obviously ingest it orally, and you whatever. So once you ingest, and this goes with any pill. It doesn't. It's not just for oral steroids, but any pill goes through affects your whole body. Your
Body,
liver, once it
right.
synthesizes
Mhm.
this pill, it goes through the whole body. It goes through the tip of the finger as well as the tip of your toe, right? And
Mhm.
whatever percentage of this medication gets to the area that is affected, that's it.
Mhm.
That's
That's
it.
it.
If it's
Right.
10%, that's it,
Right.
right? That's more often than not why we have to give you so much steroids orally in
Yeah.
order for them to be effective,
Effective.
right?
Mhm.
Now, we talk about the injections, and a lot of people shy away from injections because they freak them out or whatnot. First of all, there's many ways that to make them as painless as possible by using topical numbing medication and whatnot to really,
Mhm.
if you can numb up the skin, pretty much once you get past the skin, there is no pain because there's no pain receptors in that musculature area that would actually cause you pain. But furthermore, talking about the steroids themselves, we are able, because we're going directly to the area where the issue is,
Right.
we can give significantly less. Okay. At
Mhm.
this point, there is no therapy. There is no regimen of
Yeah.
you come in every so many weeks and then we'll provide you with this steroid injection. No.
Right.
You do one or two based on, typically we find some trigger point injections, or if we're doing
Right.
the injection, which find some trigger points, which is kind of like tiny Charlie horses, right? That
Mhm.
happen to your back or to your traps or to your shoulders. You can find them on your bigger muscles like your
Yeah.
thigh and stuff like that. Or if you're injecting it into a joint, knee, shoulders, that kind of thing, or the spine, whatever, the spinal column. The difference is that we can give you so much less, right?
Mhm.
Creating the possibility of side effects, that much less, because
Mhm.
we don't have to give you a whole week's worth,
Right.
you know,
Exactly. Yeah.
of steroids. Another thing that some providers may do is, if that whole week's worth did provide some improvement, but not
Yeah.
all,
Yeah.
the provider will wait a week or so, and then they'll repeat the steroid pack,
Right.
right? And this is just, it shouldn't be. If you have the option of providing the medication directly where the injury is, and getting better sooner with a lot less medication, why
Yeah.
wouldn't you?
Why wouldn't you? Yeah, for sure.
Right. you
Exactly.
know
Awesome. Thanks for explaining that. We do have a question. So, our question is there any type of injury or medical condition that could make chiropractic treatment unsuitable after a car accident? I think you kind of touched on that a little bit
yeah.
earlier with that, but maybe go into a little bit more detail.
Right. Briella, that's an awesome name. So first things first, I'm not a chiropractor. Okay. I'm an orthopedic physician assistant, so I can't truly speak to this from a chiropractic standpoint. I have worked closely in my line of work. I work very closely with chiropractors. One is the main one that comes to mind is particularly in the state of Georgia. For some reason, there is some uh, law about chiropractors not being able to work with cancer patients or patients that have kind of work with that. That's really the main one, and it kind of throws me off. When I knew about it, I was like, I can't even understand the reason why, because I deal with cancer patients. I actually have current patients that are dealing with that, and have had deal with. I can't understand the reason behind it. Now, in the and the reason why I mentioned this is because you can be in the middle of treatment or whatnot, get into a car accident, and that's one of them, right? It doesn't have, obviously, I probably had it 2 or 3 times happen in my lifetime. But when I asked the chiropractor, hey, what's going on here? They're like, you know what? There's something about the state of Georgia that doesn't allow us to deal with this and this and this. So for further information, talk to your chiropractic, your community chiropractor, and they can maybe they can kind of school us both. Outside of that, there really isn't anything that, in my opinion, would prevent you from picking an orthopedic or chiropractic care, other than, and this I don't. This is a tough one because I have a lot of friends in the community that are chiropractors, but sometimes you just want that thorough medical thorough medical orthopedic understanding. Okay, that just simply, and I have some chiropractors that are awesome, some chiropractors that are still great, that are great friends of mine, but they're not as acquainted with certain injuries and certain, like I was mentioning earlier, some stick to spine, some stick to extremities, some do both, right? Versus the typical ortho will kind of be able to give you the full spectrum of it, the full understanding. And then from that, you can deviate over to orthopedic or physical therapy. But at the same time, we can all work together. Mm-hmm. So should I pick one or the other it really depends on that's a tough question because it really, really depends on the injury, right? And there's some injuries that are simply like fractures, for example. I don't know of any chiropractor, and by all means, if there's any out there, please feel free to contact me. We'll chat it over. But I don't know that any chiropractors that will sit down and either reduce a fracture and or cast a patient, And so that's another. But there might be some out there that might have this ability, and this might vary a little bit state to state too, So, but that's kind of like my answer to that question. Oh, we might have lost. I think we might have lost Amanda there a little bit, but Adriana just. I'm just gonna pick it up here. Ron just left us a question. It says, "What can I do at home to supplement my treatment and aid in my recovery after a car accident?" So that's a great question. It depends on the injury, neck and back. It really depends on the injury, and for that one, it's almost like I would have to see you and determine, okay, what's the injury, what's the physiology behind it that is causing the injury, and then what I would possibly do in this particular case. If it's something that the chiropractor or the physical therapist can also help with providing some exercises and whatnot, that's probably what I do. I would have you sit down with one of them to help you kind of understand exercises. With that said, rule of thumb, and this is all across almost every car accident. Okay, with the exception of some fractures, and we can have that conversation later. More often than not, there's gonna be an anti-inflammatory underlining cause, right? So you want to do whatever will calm down this inflammation, right? Great starter is simply cold compress. You cannot underdo it. You can, as long as it's not something that is direct to the skin and is irritating your skin, you cannot underdo the cold compress. The more, the better, right? The other thing that you can help supplement your injuries or as your recovery really is obviously it's the more common stuff like not adding injury to insult, right? So if your injury is in your ankle or foot and you're going out exercising, going out for a run or going out for a walk, or God forbid you work in a factory that is really big and you have to walk all the time, maybe talk to us so we can give you a disability form so we can kind of offset this a little bit. Maybe you can stand and sit as tolerated versus walking a lot, right? The other thing is just simple stuff as anti-inflammatory medication such as ibuprofen and Aleve. It goes a long way. This is something that needs to be understood with when we're talking about anti-inflammatory medication is two things. One, if you start having any reflux or any heartburn when taking anti-inflammatory medication, stop it and contact your medical provider, whoever that may be, okay? Because we don't want to chance an ulcer, a gastric ulcer, a peptic ulcer, which is just a little wound to the lining of the stomach, in trying to calm down inflammation and fix my neck pain, fix my lower back pain. You don't want to do that. Then you have a surgical issue trying to fix a non-surgical issue or a possible non-surgical issue. The other thing with inflammation is inflammation does have a rebound effect, and that's something that we don't teach enough. If we don't steadily calm down inflammation, but only take anti-inflammatory medication when we have pain, right? What will happen is it'll bring down the inflammation so much that what will happen is and we just stop taking anti-inflammatory medication altogether. It'll just rebound, and next time the pain comes back, it'll likely be worse than not. So what we want to do and this is in the face of a car accident or an injury or slip and fall. Because if we're dealing with a headache or something like that, that's different. That's a different story. What we want to do is do things just like cold compress or an anti-inflammatory regimen that will continually dampen the inflammation until it's fully extinguished. So you want to see, if we're looking at a graph, let me see if I can do it right there. So you don't want to see this, right? This throughout the graph, that's not what you want to see. Instead, you want to see a small line with you're going to have up and down, but the trend of the graph is going to slow down until it's non-existent. And that is, if you were to graph your inflammation, that is what you want to see. And that is the proper type of treatment and care and that you want to follow. Okay.
Awesome. Well, that was so much great information. Unfortunately, we are out of time, but thank you so much, Jose. If you weren't able to join us today for our live session, no problem. The recording will be available on our Facebook page, YouTube channel, and Instagram. If you have any further questions, feel free to contact us via our social media page or give us a call to the number on your screen. The number will come down below. Don't forget to join us next Tuesday at 12 o'clock. On the Delta Orthopedics Facebook page and our YouTube channel. Have a great day, guys, and thank you again so much.
Thank you, Amanda. Thank you, and thank you all that asked questions. And
they were great questions. Thank you so much, guys.
Bye-bye.
Bye.